Here's a list of common antidepressants, the TCAs, and the second generation TCAs. There are 9 first generation TCAs that are currently available, and they have all clinically shown to be equally effective. So common antidepressants, there's only one MAOI listed here, and that's Nardil. Some SSRIs are Prozac, Celexa, Paxil, Zoloft. And what do you think is the most widely prescribed antidepressant in the United States out of these? It is Zoloft. If you guessed Zoloft, you are correct. Let's look at bipolar disorder. Bipolar disorder is also known as manic depressive disorder, and it's alternating episodes of mania and depression. Lithium is the most common medication, and the common side effects of lithium are tremors, goiter, and polyuria. Poor patient compliance often occurs during manic episodes, and Tegretol, Depakine, Depakote are also used with bipolar disorder. Now let's talk about drugs for Alzheimer's disease. Alzheimer's disease is characterized by progressive memory loss, impaired thinking, personality changes, and progressive inability to perform routine tasks. And in ALH4, we actually were just discussing this, I think it's this week, because we're talking about geriatric care. So for Alzheimer's disease, age is a major risk factor. Cognex, Aricept, Hydrogyne, and Exelon can help relieve symptoms. So I have a question for you, and you should know this if you have done your ALH4 lectures and reading. How is Alzheimer's disease diagnosed? You are correct. It can't be diagnosed until the brain is examined after the patient dies. I hope you got that. Moving on to attention deficit hyperactivity disorder, ADHD. This is common in children with symptoms of inattention, hyperactivity, and impulsivity. 4 to 8 times more common in boys than girls. And goals of ADHD treatment is to reduce the hyperactivity symptoms, reduce the sleep attacks in patients with narcolepsy. Some side effects of the drugs that treat ADHD are insomnia and weight loss. ADHD medications are Schedule II medications. You take an AM dose after breakfast and the last dose by 4 p.m. so that you can actually sleep in the evenings. Lower caffeine intake from colas, coffee, and tea, again, because we're looking at we're calming the ADHD, but we're using medications that actually stimulate. So we want to make sure that we lower this intake and that we take that dose, the last dose by 4 p.m. so that we don't end up having interruptions in sleep. Do not give CNS stimulants for more than 1 year without interruption. It can suppress the growth. Allow drug holidays on weekends and during summer if possible. So a lot of the children and adults that are on ADHD medications look at not taking it during the weekends and during the summer when they don't need to have that high focus, and they can actually not be affected, say, by school or work or other reasons that they might be taking the medication. Again, the goal of ADHD medication is to reduce the symptoms of hyperactivity and increase the attention span. Drugs used, we look at Ritalin and Ritalin SR, Concerta, Strattera, Cylert, Adderall, and Dexedrine. Again, remembering that we're using those CNS stimulants, so we need to make sure that we are using them properly and correctly. Now, that concludes our lecture on Chapter 30. I did want to give you a brief note on the Chapter 29 content. I decided to put that in a format that's a key points lecture because when you are doing your final, again, I kind of let you know that part of your final is going to be making a drug binder with things that you've already been producing over the last semester. And I will be giving you more details next week as far as the specifics of what that binder will look like. But for your Chapter 29 lecture this week that went along with this Chapter 30 lecture, make sure that you go over all of those key points and check them with your notes and understand the material. And also, you will be printing the Chapter 29 material out and including it in that final binder that you're making. I hope you have a great week. I look forward to seeing you. Bye-bye.